This presentation is made possible by the Association of Professors of Gynecology and Obstetrics Medical Education Endowment Grant. The content is solely for educational purposes and does not necessarily represent the views of the Association of Professors of Gynecology and Obstetrics Incorporated or Western Michigan University. Homer Stryker, MD, School of Medicine. Case 14. In this scenario, a 24-year-old woman comes to see her obstetrician for the very first time. After moving to the area, she is approximately 6 months pregnant.
Oh, hi.
Hi.
Dr. Rodriguez.
My name's
so
Ayana.
Nice to meet you.
Nice to meet you too.
Well, congratulations on your pregnancy.
Thank you. Thank you for seeing me. I'm looking forward to having my baby soon.
Well, I understand that you're new to our area and you moved here about a month ago, is that correct?
Yes, my husband and I, we just moved here. This is our first baby.
Well, I just wanted to review your records, and it looks like a lot of it's very, very clear and well documented, but what's very impressive is that you've been to many doctors in many cities. Why is that? What's up with all the different cities that?
Well, we just travel a lot, nothing to tell.
The nurse tells me that you don't want to even undress today for your first exam.
Well, I've been checked so many times. My husband tells me I don't need to be checked again and that I just need a doctor lined up to deliver the baby.
Well, one thing we'd like to impress upon you here at this practice is that we have a very supportive staff to be able to have the best for you and your baby. And it's very nice for us to be able to have our own documentation of your exam. So would you allow us to be able to examine you? We have a nurse, we'll have an escort, we'll be happy to be able to be very kind and considerate to your wishes.
Well, can you just do the ultrasound then?
Well, I'd just like you to be able to feel comfortable. I'd like to be able to listen to your heart, listen to your lungs, maybe check your reflexes first. Then we'll bring our nurse in. And is that okay?
Maybe I'll just come back another time.
Yes?
I'm so sorry to interrupt, doctor, but our patient's husband is in the waiting room. He's insisting that he has to come back right now. What would you like me to tell him?
Well, just let him know in our office that she's very safe. We're just speaking to his wife, and we really take pride in making sure that she and the baby are okay, and that he'll have an opportunity to join us in a few minutes. So please be patient.
Okay, thank you. I'll talk to him.
Well, it just seems that he's a very anxious person. I mean, he's really raising his voice.
Oh no, please just don't get him mad. Just let me go and let him in here and let me leave with him. I just can't deal with him getting upset.
Why would he get upset?
Well, he has like some anger issues and he wants the baby and all, but he gets upset very easily.
And if he gets upset, is it just yelling or screaming or working out, running, or what do you mean by that?
Well, he just has like a lot on his mind, and I just try to give him what he wants.
Well, one thing is for sure, we want the best for you and for your baby. And it seems as though there are some areas that I've noticed that there's some bruising. He's not hitting you, is he?
I can't say. He will get so mad. I can't.
Well, one thing's for sure. Anything you tell us here is strictly confidential. And I think that it'd be nice for us to be able to have the support that you and your baby deserve. We have a social worker here that would be able to work with you. And again, everything you say in these walls is strictly confidential.
It's not his fault. It's mine. I work 4 days a week now, every day, and He says I need to take care of his needs and that I'm not good at it. So he tells me he has to hit me to get me to understand.
Well, I appreciate your openness, and I think that we'll be able to help you and support you to have a healthy baby.